right. Once again, a very good evening, everybody. Thank you for joining us today at the Pediatric Respiratory Health webinar, jointly organized by Yuan-Sang TCM Clinic as well as Lollababy Singapore. My name is Desmond, and I'm your host for today. So today we have a very special guest, which is a physician from Yuan-Sang TCM Clinic. His name is Physician Kong Teck Chuan. Okay, so if you can see my screen now, so this is Physician Kong Teck Chuan. Physician Kong actually holds a Bachelor of Science in Biomedical Sciences from Nanyang Technological University, as well as a Bachelor of Medicine in Chinese Medicine from Beijing University of Chinese Medicine. And he is a bilingual physician and is registered under Singapore's TCM Practitioners Board. Okay, so basically today's scope of presentation, it's going to be this. We're going to have a short introduction on the pediatric respiratory issues, as well as the causes in TCM perspective. And then we'll learn how to manage respiratory health with TCM. And then Physician Kong is going to share some self-help tips, and before we go into the Q&A session. And lastly, we have a sharing by Lollababy as well. Okay, so without further ado, one more thing, yes. If you guys have any questions you would like Physician Kong to answer, feel free to type them in the chat box, and then we'll have them answered in the Q&A session later on. Okay, so without further ado, let us introduce Physician Kong Teck Chuan.
Oh, hello.
Hi.
Hi. Good evening, everyone. Hi.
Okay, so I'll pass the mic to you.
Yeah, sure. Thank you, Desmond. Okay. Thanks for joining us, everyone, tonight. Can you hear me loud and clear? Okay, cool. All right. Okay, let's start. So today's topic will be about common respiratory health issues for children. I would say between like 3 to 18 months, more commonly seen this kind of issues, but like it's not limited to that age, but yeah, in our practice, it's more commonly seen as well from this age. Sinusitis, allergic rhinitis, and also asthma. So I'll go through each of it in detail, each of these common issues. Okay, next please. All right. So first, let's talk about the sinusitis. The common symptom of this, basically we call it a sinus, right? So there's an inflammation behind this cavity behind our nose. So it starts to, because of this inflammation, it have this pressure acting on the eyes and our cheek. And so sometimes it get blocked, congested, and then even as adults, right, we have this reduced sense of smell, headache, because the ear, nose, and throat, right, ENT we call it, they are all linked together. So eventually it can also cause cough, sore throat, and even they call it the green and yellowish mucus, meaning to say this in Chinese, in TCM is we call it becoming heaty lah, because if it's clear mucus, then it's more of a cold type of. Later we will talk about that in detail, the different syndromes or different type of these sinusitis. Okay, so let's take a look at this, the different views in TCM for this sinusitis. So there is there are 6 categories. External pathogens, meaning to say which like environment from outside that can affect us internally. So environment from outside, like too much wind, too much. So if these kind of pathogens are, if they are in balance, or if they are not in excess or too little, then it will, most of the time it will not cause disease to our body, right? So if it's this wind is too strong or too heat, maybe you in the sun for too long, dampness. Singapore is quite famous for our heat and dampness, the environment, right? So fire and dryness and even cold, right? So all these can act in alone, the pathogen, or they can be in combination. And most of the time, the first one, the wind pathogen, would bring along other pathogens as a combination, right? So here we will talk about the two, the most common combinations, the wind cold or the wind heat, right? So just now we mentioned about the mucus yellow and the mucus clear, right? So in this case, we would say that yellow mucus is more towards the wind heat, and then the clear mucus is more towards the wind cold. It is in a general sense, yeah. In Western term, you would say it could be a virus or infection for the yellow mucus, right? So it's kind of like a good news because your body is fighting back, right? So the cells or the white blood cells, they kill off the germs and then they die, and then you have this wind heat. Yeah, sorry. Okay. Right. So and then let's come back to TCM. Yeah. Then you have a weakened lung system. This is an internal factor, right? So we talk about external, like pathogens from wind, heat, wind, cold, and then internal, it can be due to like poor eating habits, emotional stress, etc., which later we'll focus more on. And then they can eventually lead to a phlegm accumulating in the body, and then presented as mucus when we expel it. Also, something about the external and internal, because in TCM, we view the lung system as internal, but from the external pathogens, it can weaken the lung inside, and then your respiratory tract would accumulate the phlegm. So that's why it presents as mucus. Yeah. Okay, next slide. Yeah, so we mentioned about the internal factors, the poor eating habit, emotional stress, and also body constitution, meaning to say what our parents give us, or some would like to view it as like a genetic, right, or DNA. Yeah. So this bolded or this PUation transit. So sorry for those who don't understand the Chinese. So basically in English it means spleen produces phlegm while the lungs store it. So these two are the major organs in TCM, which we this is TCM saying, means to say 脾为生痰之源 and 肺为储痰之器. So spleen or the P, it's you can think of it as a general digestive organ or digestive functional organ unit in TCM. So like so we can see from those the big points like poor eating habits. So you can have due to irregular meal time, or like even sometimes skipping your meals, or just I think kids would skip meals, but more of the time I think we see that parents would overfeed the kids sometimes, yeah. So all these too much or too little, right? Then it can also cause eventually lead to spleen system having a weakness and then unable to digest it well, or even to assimilate the nutrients. It can lead to this stagnation, and then dampness can accumulate and then eventually become the phlegm. And then you can, like we said, you can see it expelling, the body try to expel this excess dampness and phlegm. So you can see as mucus. And also, not just kids, right? Even as adults, this kind of food, they are too much in tasty, yeah, oily, greasy, fried, spicy. So it can also accumulate this heat and dampness in the body. So and then aggravate the sinusitis. That's why when we have this blocked nose, we have this cold or flu-like symptoms, doctors or physician will always say to take light food, right? To take food that are easily more digestible, right? So in this case, we also can see how the TCM organs are linked, right? If you digest well, then you don't have accumulation of phlegm, and then you don't have this phlegm being stored by the lung. Yeah. And then let's talk about emotional stress, not so much for the kids lah. Maybe much more on the body constitution, like lung, spleen, stomach, qi deficiency, meaning to say these three or these two organs are, like we mentioned, if they are functioning well, then the phlegm or the dampness won't get accumulated. So if it is deficient, it is not in like a simple analogy of lack of qi means like very tired, like things don't get moving, right? So if things don't get moving, or the dampness and the water don't get moving, it get stagnated again, right? So again, it can lead to phlegm being produced. And then another one, it's the heaty constitution, right? So sometimes we would say this HEAT is more prone to like there's latent this heat toxin in the lung. So and also this heat sometimes it doesn't happen, but you are more easily to get heaty, right? But from outside, maybe external pathogens or like outside weather is a bit more heaty, or you eat some durian or something. Okay, kids don't eat durian, but yeah, something heaty. Maybe the mom eat durian and then the mom breastfeed the kid, right? So it can also lead to have more accumulation, right? So and then it can accumulate the heat in the skin. Okay, so oh sorry, let's go back to the previous slide. I just talk a little bit more. This sinusitis, we also categorize them as acute and also chronic lah. So acute is less than a few weeks. Chronic can take even much longer. So we have to. Sometimes it can also be due to underlying problems with the structure. Like remember just now we saw the cavity, right? So the structure of the nasal passage behind, and maybe doctors would suspect there can be nasal polyps lah, right? So is also we have to talk about the internal factors, the body constitution, and also deficiency, right? So in many individual, if it's not treated well, it can become chronic. So because like after infection, it keep happening like recurring, right? So the method of treatment, like it not able to drain out the sinus cavity completely or discharge the mucus. So it becomes a pattern like infection after infection. So we have to treat this infection actually like uh most of the time, like, yeah, we will use antibiotics, right, for the doctors. But in TCM point of view, like after you use antibiotics, it can weaken the immune system and sometimes may cause problems or like they call it 脱尾, 拉尾. I mean, the cough or the sinus doesn't really fully heal, or after heal, there's still that recovery period. So I like to share that TCM modalities can break this pattern because we designed to like boost the body immune response as well. Okay, let's talk about the next slide. So in this case, we have some tips for pediatric treatment and the acupuncture, and also even herbs. I'd like to share these 2 points for simple relief to opening up the nasal passage for the kids. So we have this 鼻通 shape, means another word for it, we call it 上迎香啦. 鼻通 basically means to open up the nose, right? So it's right above this nose bridge below here, right? So you can use your hand or your thumb and just put it over there at the acupoint and slowly massage the area, right, until the air flows. And same thing for the 迎香穴, right, just beside the nostril. If you use a little bit of strength, you would feel a bit of achish and tenderness. Yeah, but reminder for kids, their skin are a little bit more soft, so we have to be careful when we do massage, or like you can use a little bit of baby oil or baby powder. Okay, then we'll go on to the next one. So allergic rhinitis. So allergic rhinitis is also it will cause inflammation in the nasal cavity, but the triggers are more due to allergens like dust, pollen, etc. The common symptoms we see are like sneezing, runny nose, right, clear watery mucus, sometimes itchy and blocked nose as well, and also a sense of smell being lost. So this inflamed mucous membrane behind, right, at the same time, it can also cause congestion because it get inflamed and then get expanded. So you experience blocked nose, and even also that's why you have a sense of smell being lost. Okay, next. And again, we talk about mucus. There's a buildup of mucus also when it's not clear entirely, and then it can get infected by bacterial virus, and then eventually lead to this sinusitis again, right? From what we learned in front. Okay, so let's talk about TCM view. The allergic rhinitis is also commonly known as nasal blockage. That means the etiology behind this is that the lung qi is deficient. That's why when there is, most of the time it's due to a pathogenic cold from outside, it invades the nose, then it can cause the nasal congestion. So you have like sneezing, rhinorrhea. It's this watery, this flowy, like you open the tap, you open the tap, then the phlegm keep coming out, watery fluid, mucus fluid, sorry. Yeah, like we mentioned, due to weakness of the lung qi, unable to protect, this, we call it wei qi, so unable to protect your nose and your lung system, right? Or even a weak spleen, because the spleen, again, like we mentioned, so digest, assimilate, give the energy, give the qi, such that this qi, a form of the qi, is the protective layer, the wei qi, we call it TCM. So if the spleen is weak, you are not able to provide nutrients enough, then it can contribute eventually to the lung qi being weak as well. Oh, sorry, let's go back to the previous slide. So allergic rhinitis, like we mentioned, is allergens, right? So to take note, some allergens, common allergens are like, there are four main categories are skin contact, injection, ingestion, inhalation. So skin contact can be like poisonous plant, animal scratch, pollen. Pollen is very, very common. Commonly seen. Some people have latex. And then injection like bee sting or like some drugs. That's medication injection. And then for some kids have nuts and shellfish, right? This allergic reaction. And then inhalation also, again, it's commonly pollen, dust, right? Dust, mold, mildew, and some animal dander. Yeah. Okay, right. Then let's go on to the asthma one. So asthma affects the airway. The attack happens when the flow of the air to the lungs are obstructed. So like you try to take deep breath, you cannot breathe properly, right? So asthma, it can be a cause of due to allergic or non-allergic, right? So for allergic asthma, most of the time is due to the environment allergens. So they trigger when you inhale or you ingest the allergens. So asthma trigger can be anything that irritates the airway, and then it sets off the cascade, the symptom of the asthma. So common trigger are like cold, flu, cigarette smoke, allergens, like we mentioned, like pollen, right, furry, feathery animals, or even like house, the dust mites. Yeah. Okay, then moving on. Yeah, let's talk a little bit of the Western medicine, which are commonly used, right? So in Western medicine, we have medication and tablets that help to manage the condition. So devices like inhalers, commonly they use it, right? So inhaler, it's, oh, okay, question. Yeah, any questions in the Q&A? Yeah. Okay, how do I close this? Okay, yeah. So we have two main types, like relievers and preventers, like you can see here. So what I mentioned, oh yeah, so inhalers, right? It is a good way to actually relieve or even treat, because it deliver directly the medicine straight to the lung to help the lung relax the muscle, right, or to calm the inflammation of the airway, so they become less reactive to the trigger. Right, so the two main type of medicine, reliever and preventer. So reliever help to open up the airway, allow the muscle to relax, so you can breathe more easily, lah. Right. Then reliever is usually used when the asthma happen, like you the puff, lah. Okay. Then preventer, it's more of those circular that you like here to suck every day. So that one is to calm the inflammation of the airway and then reduce this asthma reaction. So normally these are they take regularly. Then most of the time is inhaled corticosteroids lah. Yeah. So on the other hand, in TCM, next slide please. Okay, in TCM, we talk about like, so you see our recurring theme today. There's a phlegm, right? So phlegm, we think of phlegm, we think of spleen, we think of lung, and in this case, there's one more organ we talk about, kidney. Okay, so in TCM, asthma is caused by excessive phlegm. We call it 树痰. It means the phlegm has been in the body for quite a long time. It can be due to weakened spleen, weakened kidney, weakened lung. The two main organs most of the time it's the spleen and kidney, because these two organs in TCM, they are responsible to this process the body fluid or body liquids in the inside our body. So eventually, these contribute to the lung qi, the health of the lung. So you can think of it like the water passage, the lung, the upper passage, then the spleen is the center, and then the kidney is the lower one. So these need to flow well, lah. So Okay, coming back to this, we have two general classification of asthma in TCM. So it's simply you can think of it as excess and also go back to the sorry, I didn't really write this down, but yeah, you can think of it as excess and deficiency, right? Too much or too little, right? So excess means to say it can most of the time is corresponding to acute asthma where you have like tightness of chest, severe shortness of breath, wheezing, and even feeling like thirsty and feverish, right? Then the deficiency one is more often than not the chronic asthma where patient will have like a wheezing, like that sound, that asthma sound, right? Sweating, general lassitude, meaning to say fatigue, right? Cold hands and feet, right? So there's two main general category lah. Okay, and then let's move on to the next slide. Okay, so there are many factors that can trigger asthma attack, right? Just now we mentioned, right? Pathogenic diet, emotional, congenital, weakness from when they're born, or even chronic illnesses. So here, TCM, we want to talk about 哮喘. For those who don't understand Chinese, it means wheezing and dyspnea, meaning to say wheezing like the sound, like that sound. Or when we use the stethoscope, we can hear in the lung, there is that that sound of that wheezing from the air sacs of the lung. And then there is dyspnea, meaning to say shortness of breath, like 气短, like very shallow breath, right? You can't breathe deeply. Okay, so these two we actually categorize them differently, right? In asthma, for TCM in asthma. So 哮 is the wheezing, 喘 is the shortness of the breath. Okay, so these two are actually reviewed as separate illness, so-called, and then there are different treatments for them. So 哮 wheezing is the whistling sound, like we mentioned, during the breathing. So you have like increase respiration, right? You try to breathe faster. Okay, then Jia Jie. Okay, I'll answer the question in a while. Let's finish this. Okay. Shortness breath. Where were I? Oh yeah. All right. So dyspnea, that means xiao, I mean to say wheezing can also have the shortness of breath, but shortness of breath is only just shortness of breath, like so it doesn't include the wheezing in TCM category. Yeah, so you dyspnea, like you keep opening the mouth to grab the air, like the shoulders, you raise the shoulder, and then the nostril, like trying to grab air lah. Okay, so yeah, so just to summarize again, the xiao, the wheezing, generally, most of the time will have shortness of breath, while patient with chuan, shortness of breath, may not have that wheezing sound, right? Okay, so, oh, okay, yeah, we leave the Q&A to the end, yeah? Okay, thanks. Okay, let's continue. Yeah, causes of this issue, right? So talking about asthma again. So it's very common for these patients who have like recurring asthma to, just now we mentioned the three organs, right? So the upper, lower, upper, the lung, middle, the spleen, the digestion, and lower, the kidney. So let's talk about the kidney. Why is the kidney involved here? Because kidney deficiency in TCM point of view, kidney Qi is in charge of, you can view it as the bottom, the stabilizer, the 基础 the foundation. So it requires to grab the air from the top, right, to the root of the kidney. So there's a phrase we call kidney qi is in charge of the deep qi. So the lung is the master of qi, but kidney is the root of the qi. So think of it as the tree, right? The lung is like the tree, right? It looks like the tree. So where are the roots of the tree? So they are at the kidneys, right? For TCM lah. Or you can also think of it, analogy is like deep breathing, or like deep breathing versus shallow breathing, right? So grasping the air is like breathing through the diaphragm from the stomach lah, the 丹田呼吸, right? So it is the lower root of the lung. Okay, so so deficiency of the lung. Let's take a look at the next slide. Okay, I didn't include this. Okay, so just now you talk about there is deficiency, there's excess, right? So same thing here. let's first talk about deficiency. So deficiency of lung is most of the time the kid is scared of cold, scared of wind, spontaneous sweating, because the protective qi cannot keep the sweat, or cannot keep the han inside the body. Excuse me. Right. So deficiency of spleen also, spleen cannot function well. There increased production of phlegm and sputum again. Right. So before we talk about the symptom of heat of the lung, let's talk a little bit about the trigger also, right? So like just now we mentioned, there's the diet, right? So for this kind of deficiency, one most of the time is the raw and the cold food, right? They can injure the spleen, right? And then they eventually contribute to fluid circulation being stagnated, and then eventually contribute to production of phlegm. That's why TCM always say don't take cold food. Okay. So another thing is sweet and greasy food. Like, you know, even for us adults, not just for kids, if you take too much of those sweet and greasy food, then it create more phlegm, right? And then if the phlegm doesn't get clear or it accumulate, it can lead to heat, because you just think of like a machine. If it doesn't run well, it gets stuck. It gets stuck, the heat accumulate. So same idea, right? Another thing is fish, crab, shellfish, all those seafood. Sometimes it also been noted that increased likelihood of asthma attack because they can be possible allergens, right? And then we also have the genetic and congenital weakness, right? Like chronic illness. They also are common causes of asthma. So, like we mentioned, for TCM, the kidney qi deficiency or due to congenital means when they are born. So, or even with those who have chronic illness, like chronic cough, recurring cold, flu, it can likely lead to lung deficiency, right? So, coming back to the fundamental cause of asthma, just a recap, is the presence of phlegm, right? So, and then let's link it back to the passage of water, right? The three organs, the lung, spleen, and kidney. So, imbalance between any of these three organs can lead to stagnation of the water circulation, right? So, and then it contribute to production and storage of the phlegm by the spleen and the lung. Okay. Okay, and then let's talk about the other type of asthma is due to the heat. So, okay, other than wheezing, coughing, like cough spells, crackling, phlegm, or sputum that is difficult to spit out, right? These symptoms, and this phlegm, sputum usually is yellow, but it may be white color sometimes when the heat is not so prominent. There are also other symptoms like fever, irritable, perspire a lot, hot sweat, headache, dustiness, reddened face, or all the upper symptoms here. Right, so in TCM theory, the treatment for this excess pattern is to dissolve the phlegm, right? And then for the deficiency one is to strengthen and tonify the weakened qi. So the weakened qi is actually the body's energy, essential energy. Okay. Right. So for the heat part, I have this very simple herb, maybe more suitable for a little bit older kids. For young babies, it also can, but you have to the amount is very small and very little. So we have 香叶 mulberry leaf and 菊花 hangqu chrysanthemum flower. So it's called 桑菊. There's a formula 桑菊饮 lah, but in simple today we use these two ingredients so they can expel the wind heat from the lung and nasal passage, so prevent the accumulation of the heat toxin. So you can brew into tea, you can cool it, and maybe kids like a bit more sweet. A little bit of honey is fine. Yeah. So, and then next, this is for deficiency, right? Or for recovery stage. So you nourish the qi. An example of herb, we can use Shening Baizhu. So this is to help improve the spleen yin part, pi yin. And then beyond this immediate cause of illness, right? So we also TCM view that we need to boost the immunity, right? Particularly if the patient is a child. So you can also use tuina, right? Xiao tuina, pediatric tuina, along the spine area. Later we'll talk about some of the acupoints and also at the abdomen area, right? So the herbal formula help to improve the lung and spleen function. Like the tuina also promote the balance in the body and improve the overall health. Okay, let's look at some of the acupoint. Yin Xiang is just now we mentioned, right? So yeah, just a recap, right, at the nose area, right, 上颌象, so you can use it, or the 鼻通穴, right? So this one, you can massage for 1 minute. Yeah, 1 minute is fine for little kids. 1 to 3 minutes is fine. 合谷穴 is very commonly used. So basically, it's if you can see my hand, is between the finger and the palm. There's this muscle here, right? Okay, maybe I'll show how to. Basically, use your one of the palm, the line, and put it at this wet area, and then go down. So it's at this area. Yeah. Okay. So you don't have to stimulate too hard for the kid. It's quite sensitive. Yeah. Okay. So 合谷穴 is to help increase the blood circulation to the face area. We call 面口和骨收. So the face and the mouth and the pain in the even for pain symptom like headache, right? So use the 合谷穴, increase the circulation so as to help to bring the pathogens away. Another thing to take note is to avoid oily, spicy food, right? So if you can, regular exercise build up immunity. So and also eating, sleeping habits. For allergic rhinitis, just now we didn't mention, so just avoid the allergens, right? Okay, moving on. All right. So I think this is almost the last part. We have this pediatric tweener. So little kid. Okay, let's talk about the 肺经. So 肺经 is on the little kids' hand is the fourth finger. Okay, the ring finger. So clearing. Okay, so there are two. Not two. Okay, maybe three. Modalities of using this 肺经. So if you push, okay, normally the kid's hand will be like this, facing me, right? So we will use most of the time it's like this, using a palm like that. If you push it towards the palm, it's to booster the lung meridian. So for those with deficiency, if we swipe it away, swipe it towards the end of the fingertip, is to clear the lung meridian, right? So this is to booster or to clear. Yeah. It's one of the common pediatric trainer that we do. And another one is to 开天门, so gentle this forehead stroke. Let's see, do I have a model? Don't have. But basically, the kid is, if I'm a kid, then the position is like that. Then it will be like going out like that. I hope you guys can see it. Yeah, right. So 开天门, like gentle forehead strokes upwards. Okay, so it's actually to help tone this nasal cavities behind as well. Yeah. Then we have rub the abdomen. So rubbing abdomen also help to improve the spleen movement. So you can rub in circular motion, or you can rub it like sideways downwards, depending on if the kid have bloated stomach or not as well, right? Okay, if more bloated, you can rub it like that. If it's constipated, clockwise, a bit diarrhea-ish or anti-clockwise. Okay, then there are some acupoints to 三里天枢影像太阳疟疾. Okay, let's see how do I show? Okay, maybe it's a bit difficult. Okay, so basically, 足三里 is on the kneecap. Then there is the two right below the knee. Okay, so basically this is the kneecap, right? So you feel there's two indentation, right? Then the kid's four fingers, the indentation, and you feel the bone, so it's right outside. Okay. You guys can Google. Sorry, I'm so sorry. You can Google the picture, but okay, let's see. I'll continue. 天枢穴, okay, 天枢穴 very easy. So it's at the stomach. There's two nipple. You draw a line down between the belly button and the nipple line in the middle. Okay, so same thing, you can massage the area. 影像穴 is 太阳穴 is at the side of the head, right? And then 捏脊 is to slowly from the 尾骨, the tailbone of the kid, and then you slowly do a massage upwards until the upper neck area. Okay, so it's like kneading. We call it kneading. So basically, if the baby is back facing me, right, the tailbone, and then I'll start kneading, like squeeze basically you hold and squeeze the skin upwards, and then you slowly knead it along. It can be this way, or it can be this way as well. This way will be a little bit more stimulating. Yeah. Okay. Then to booster immunity, we have 补脾补肺. So just now you mentioned already the 肺, right? 肺 is this fourth finger, right? P is this thumb. So towards, again I mentioned, towards the palm is to booster. Okay. Let's move on. Okay, then maybe for a bit more older kids, most of the time, pediatric tree now we say it's very effective for like 6 months to 6 years old kids, but it also can be used beyond 6 years old until about 12, some even say 14 years old. But as they grow older, sometimes acupoints that is beneficial for adults, we also use them. So DHA and Taiyuan. So Taiyuan is yeah. So basically your thumb, you feel there's a tendon, right at the tendon and the wrist line. Okay, so it's sorry, you see the wrist line and the tendon, so where they intersect, you press on Taiyuan. So it is one of the major acupoint for the lung. So this is the lung meridian, so it's one of the major acupoint. DHA is when you crisscross your hand, it's here right below the index finger. Right, crisscross your hand right below the index finger. Okay, so it's here. You can also feel 2 tendons around this area. Okay, so that's literally also. Yeah, so these are also to balance out the lung meridian. And then fifth issue is at the back, at the uppermost vertebrae, the C7 is the most protruding. When you tilt the head downwards, you can feel the most protruding bone. That's C7. Below C7 there is T1. So cervical 7, that's thoracic 1. So thoracic 1, 2, 3. And then you do oh sorry, there's another. BL thoracic 1, 2, 3. Then you do what you call it, scapular, and then you find the middle. So you can see from that 11, 12, 13, number 13. So it corresponds to 1, 2, 3 of your thoracic vertebrae. And then same thing, you can do massage at that area. Okay, okay, then this tonifying qi hai. So qi hai is below the belly button. So from the belly button to the end of the bone, what is it in English? Sorry, it just got stuck in my tongue. So do I have? Okay, let's draw it out. Okay. Let's see. Okay. So you can see, this is the belly button. Let's see. Belly button to the end. Okay, before your cervix, your end of it. So that's 5 inch. So it's 1.5 inch. You can measure. This is 3 inch. So you need to use the babies. Everyone has their own 3 inch. So this is my 3 inch. Your hand is your own 3 inch. Okay. So 3 inch, and then you divide by 2. That's 1.5 inch. So right from the belly button, 1.5 inch down, that's the qi hai xue. Okay. So that's to tonify the qi. So same thing, you can press on it, and then call that slowly massage on this. Okay, and then 伸住 is behind. It's right at the center of the. Remember the third. So basically the same as the just now we say the 肺腧, right? When you tilt your head down, then there's the uppermost bone. There's the thoracic 7. Then you feel the next bone down. 1, 2, 3. The third one is 伸住. Okay, so you also can massage the area, and also from the scapula to this 伸住, in the middle, there is the 肺腧, just now that one. Okay, so 气海伸住. Then 足三里 again, just now you mentioned. Okay, maybe I'll get the photo out here. Sorry, 足三里. Okay, good. There. Sure you guys can see it. Oh no, you can't really see it. Oh, there, yeah. Oh. So basically 4 fingers down. How's it blur? Okay, right. So 4 fingers down from the knee, at the top of the kneecap. Okay. You can Google it. So sorry. Okay, so this 足三里 also help to tonify the spleen and stomach. And then 中脘穴 is from the belly button to this chest bone, which you feel. This is the rib cage, right? Rib cage, and then there is a little bit of where the flesh become hard and your belly button. So it's in between that point and the belly button. So just halfway in between. Okay, and I think that's about it for the points. Yeah, that's about that.
All right, thank you, Physician Kong, for the insightful sharing. Thank you very much. So now we are going into the Q&A session. Just a reminder, if you have any questions, do feel free to type them in the chat box, and then we'll have Physician Kong to answer them. So right now, let's move to the first question. It's by Jiajie. Jiajie has this question for Physician Kong. His son had been tested to be have severe allergy to dust mites. So he always seems to be having runny nose or sneezing with like greenish, yellowish phlegm. Does this mean that there's the allergy of dust mites? Did it cause the allergic rhinitis?
Yeah, yeah. Okay, so first thing, sorry to hear about that. Yeah, it can be a very there can be that triggering factor from external, right? But at the same time, like we mentioned just now, there is also internal factor. So how come it can be like this what call it phlegm that's yellowish or greenish? So there can it could be an indicating or a suggestion that there can be internal heat as well, internal heat and phlegm inside, right? That's why they have that's why he has a greenish and yellowish phlegm. So it is true that the allergy of the dust mite can cause the allergic rhinitis, but at the same time, there is also internal factors. So when we do treatment or when we do this 调理 for the kid, we have to take note both to do this protective lung qi, right? So that the external allergen does not cause as much reaction, and also at the same time remove if there is the heatiness in the body, we also try to expel or remove it, yeah, with the phlegm as well.
Okay, thank you, Physician Kong, for the answer. Does anyone else have any questions to ask Physician Kong?
You're welcome.
Yes, okay, we have one question from Michelle. Michelle's 10-month-old baby often has wheezing when he catches flu and is on the asthma preventer inhaler medication regularly. So can he still take the herbal tea that you mentioned just now?
The Sangye and Jihua, is it? That is more of for the heat of a heaty kind of asthma. Yeah. Not, I would say it's not as recommended in this case because actually I cannot make a diagnosis right from here, but if it's due to a cold flu, right, due to a cold wind and regularly wheezing, like we mentioned, most of the time it can be due to deficiency of qi of the lung, right? The lung, spleen, and the kidney. So you have to, um, you have to see, or you have to diagnose, is it whether it was the lung, the spleen, or the kidney, which organ is it, or is it a combination, right? So I would say not to take the herbal tea, right? Because um, it can be potent, right? Because if it is heaty kind of, then yeah, it helps. But if it's deficiency, you still remove the yang energy or the, because clearing heat, if there's no heat to clear, you clear the qi and the yang energy of your body, so it can aggravate the condition. Yeah.
Yeah, I think just to add on to Physician Kong's point, Michelle, if you're unsure, you can always visit any TCM clinic to ask for a detailed diagnosis by a physician, and then that physician will then advise you accordingly whether you can take certain herbal teas or certain herbal medications. Yeah. Okay. So anyone else has any questions? Keep them typing in. Okay. Wow. Now the questions are coming in. Okay, so we have one question from BHTO. Should chicken be avoided altogether when our kid is having cough?
Yeah, a lot of TCM physicians would say that yes, you should avoid chicken. Yes, yes, yes. One main reason is it causes the phlegm or the cough to not recover, right? Especially the skin part, right? Chicken is actually like heaty, but sometimes it can be due to irritation, right? Irritation to the cough. Yeah, yeah. But in general, it's because it's heaty, yeah. And TCM, when we have cough or when we have this in Singapore context, yeah, it's most of the time, more often than not, heaty kind of cough, or it can eventually become a heaty kind of cough. Yeah. Yeah, I hope that answer the question.
Okay, and then we have another question from Justin. Justin asks, usually how long does TCM take for asthma, to treat asthma, I think?
Yeah, sorry about the chicken thing. I recall that because some also believe that the chicken can cause more phlegm, right? So then the coughing would not stop because the phlegm is always there. Yeah. Okay. Now, okay, back to the asthma treatment. Actually, it really does depend on the child and the severity of the asthma. For some cases, in general, we would say one entire 疗程 is like 10 sessions, right? But most of the time, after maybe 3 to 5 sessions, we do see improvement for the kid, right? So maybe the intensity or even the duration of the asthma, right? It becomes lesser because you must know that asthma is actually a long-term disease, right? Like we mentioned just now, the different causes and the different triggering factors, right? So even for Western medicine, our preventers, they take for a long time. But for TCM, eventually, most of the time, there can be a significant help in that sense. Yeah.
Okay, another question from Michelle. Is there a particular Yuan Sang clinic that is recommended for treating asthma for babies? I think this one I can answer. So basically, there is no specific clinics because all TCM physicians are supposed to treat any kind of conditions. Am I right, Physician Kong?
Yeah, that is true.
Yes, yeah. So it's not, yeah. So it's not like Western medicine. There is no specialist per se. So basically, TCM physicians are able to treat all types of conditions. So you can just visit any Yuan Sang clinic near you, for a detailed diagnosis. Okay, hope I answered your question. And next one, we have another one for Justin as well. He asked, would it be more effective to combine TCM herbs plus acupuncture plus Tuina for children asthma? Physician Kong?
Yeah, of course, definitely. Now that you talk about that, I recall reading research papers that with Chinese herbal remedies and with Trina, it actually, if I remember correctly, it actually regulates the immunoregulatory effects of, they call it Th1, Th2 response for the adrenal function, basically to help them uh, for the asthma and the food allergy. So and that duration was about 1 to 3 months. Yeah, just to answer the previous question with that. Yeah, and of course, it would actually be more effective. Yeah, definitely for herbs, acupuncture, and treatment.
I think, and also just to add on, I think for children, sometimes they might be a little bit afraid of needles. So acupuncture, I think it's going to be tough for physicians to administer. But nonetheless, if the kid is able to overcome the fear of needles, then acupuncture definitely helps, right?
Trina is also in a sense because acupuncture, Trina, and the herbs all acts to help the three organs like we mentioned, right? The lung, spleen, and the kidney, right? So even for like the lung meridian or the lung 肺经 we call it, right? So for the kids and for acupuncture as well, right?
Okay, do we have any more questions? Oh, Justin said, please organize more of such talks in the future. Very helpful. Thank you very much. We will definitely have more talks in the coming future. So stay tuned to our social media as well. So we will be posting up, any advertisements or any information on the next webinars. Okay. So if you guys have no more questions, then I would like to thank Physician Kong. Oh, wait. Somebody is typing. Okay. One last one. 清肺排毒 soup. So that Yuan Sang shops. I think this is a very common ingredient or common type of soup, right?
Yes and no, depends again, like the body constitution, what symptoms does the kid have, right? So we need to have at least a general idea or at least the symptoms that matches, right? So that, like we mentioned, herbs are also potent. Like if you are hitty and you take hitty herb, you got the worst. But if you're hitty, you take this 清肺排毒汤 and you get better, right? So we have to see the symptoms as well, right?
Yeah. So same thing. If you are unsure, just visit any TCM physicians for a detailed diagnosis, so that he or she can give you a good recommendation on the soup to drink. Okay. So if there's no more questions, we would like to thank Physician Kong for the sharing today. Thank you, Physician Kong. And then next we have the co-founder of Lollababy Singapore, Daniel, who will be sharing some information about Lollababy. Daniel?
Hi.
Hi, Daniel.
Hi, can you all see my screen? I'm gonna share it.
Yep. Okay, over to you, Daniel.
Okay, hi. So I'm Daniel from Lollababy, and today we'll share with you a bit more about Lollababy and how we can help you with your respiratory health for your children as well, right? So Lollababy, we are established since 2016, and one of the main reasons that we were established was basically we saw that there was a lack of quality medical devices for babies and toddlers in the market, right? So the very first medical device that we had was the nasal aspirator. And then following on, we have the nebulizers and thermometers as well. So rest assured, our devices are actually FDA, CE, and HSA registered and approved. So you do not need to worry about the safety because it's all been tested and approved, right? So today I'm going to share two devices that we have that will help with your children's nasal health. The first one is the Lollababy battery operated nasal aspirator, which is this product here that I'm holding. Okay, so basically what this does is it helps to suck out the mucus for your child. So basically for newborns, they do not know how to blow their noses. And am I sharing my video? Hang on, so sorry. I was told that the video is not shown. Second, yes. Can you all see me actually?
Yes, we can, Daniel.
You can? Okay, right. So sorry. Okay, so basically, as I was saying, this aspirator can be used for young babies, newborn onwards. So basically, the newborns do not know how to blow their noses. So so in order for them to help with breathing when they have flu, the nasal aspirator will help to suck out the mucus of the child, right? So comparing this with the manual aspirator, so there are a few kinds of manual aspirator. There is the one with the bulb syringe, where you presses the bulb and you release to get the suction. But however, that suction is not strong enough, and also when you press it again, sometimes the mucus gets splashed out as well. So it's not very hygienic. And then you have the other one with the tube, and you basically suck the mucus using your mouth. Now that is also not very hygienic, because the viruses could be passed on from the child to the adult using the aspirator. So especially during COVID, we don't want to spread the virus from the child to the adult as well. So using our nasal aspirator, basically, it is a lot more hygienic, because it's just a press of a button of the aspirator, and then the mucus gets sucked into the mucus cup. And so you can remove the mucus cup to wash and sterilize as well. Okay, so when the child also gets older, like when they are slightly older, maybe at 2 or 3, you can actually also hand the device to the child, and the child can also operate on their own as well. Yeah. So just to emphasize some other points of our aspirator. So again, as I mentioned, they are registered with the different health agencies. It runs on 2 AA batteries. We have 3 different tips available. We have the newborn tip, which has a very tiny tip, and basically this can be used for 0 to 3 months. And then we have a longer reach tip. Okay, and the tip can reach deeper into the nostril for the suction of the mucus. And finally, we also have one that's called power suction, which is slightly wider. So basically, when you have this put to the nose of the child, it completely blocks the nostril hole, and then this causes the suction to be slightly stronger. So that's why we call it the power suction. So we recommend this for the more stubborn blockage. Yeah. As I mentioned earlier, the mucus will be collected in the cup, so you can remove that to wash under the tap with water and soap as well. You can also sterilize the mucus cup after washing, right? These are some of testimonials from the different mummies that we have. So we have this testimonial from Mummy Amelia. So she says that the aspirator is godsend, and she used this for all her kids from ID to Isra, and you can see here the mucus that's collected from the nose, and she's not been well for about a month, but this helps to clear her nose since she does not know how to blow her nose yet. So a child will probably only know how to blow their nose from, say, maybe 2.5. Some child, even 4 years, they still don't really know how to blow their nose. So the aspirator will help to relieve their symptom, so clear the mucus so they can breathe better. Right. And another testimony from Mami Ati Malik, right? So she says she's so glad that she bought this, and it's convenient for her to suck out the nasty nasal discharge. And it's battery operated, so you can use this while you're out as well, yeah, not only at home. And then next testimony from Mami Hui Sing. So this showing the amount of mucus that's collected, and to her this is the best investment, right? And another testimony from Mami Nisa. So you can see this video how the daddy has been using it to suck the mucus. So yeah, so it's not really difficult, yeah, because it's it has only one button, so it's a lot easier for you to use it. So you can just use one hand to hold on to the child head and the other hand to suck the mucus. So it's quite easy to use. Okay. So the next I'd like to talk about is the battery operated micro mesh nebulizer. Okay, so for the nebulizer, it's used to treat asthma, bronchitis. Okay, the advantage of this is it has a very low noise, right? So most of the time, when your child needs to go through a nebulizing treatment, usually the clinics would use a jet nebulizer, and that is usually very loud, and that usually scares off the child. It also has to be plugged into a power socket, so it's not very portable, right? So our nebulizer is battery operated, and it's almost no noise. So it comes with 2 masks, so the adult and child can both use the nebulizer as well. Okay. So some facts about the nebulizer. Again, it's certified and 2 different masks, as you can see here. So there's the adult mask and also the child mask. These are some of the common medicines used for the nebulizer to treat asthma. This medication cannot be bought over the counter, and it's always prescribed by the doctor. Okay, so it has to be prescribed by the doctor. And then the nebulization efficiency, it dispenses about 0.25 ml per minute. So depending on the amount of medication that's prescribed, usually between 10 to 15 minutes per session, right? These are some of the testimony from some mommy. So this mommy Alicia, so you can see she's using it while the child is actually sleeping. So basically, it's so quiet, it doesn't wake the child up. So you don't need to worry about waking the child just to do the nebulization. Yeah. Then we have some other pictures of the babies using our nebulizer as well. Okay. Our products are available at our own website and also the marketplaces. You can also find them at departmental stores, baby shops, the TMC pharmacy, and some clinics as well, right? So I can take some questions if anybody has any questions as well.
There's one question for Daniel.
Okay. Yes, go ahead.
Okay. I think Tuan asked, will the nasal aspirator damage the mucus lining of a newborn?
Okay, so it does not hurt the mucus lining because basically the tip of the nasal aspirator does not go deep into the nose of the passage, so it does not hurt the nasal lining. Yeah. So especially for the newborn, so our newborn tip is very tiny and short, and you can see that it is also getting wider at this side here. So basically, you can't really tuck in too deep into the nose, but it's good enough to suck out the mucus.
Okay, there's another question from Ruth. Ruth is asking where to get the medicine for the nebulizer. Is there like a refill or something?
So as I mentioned earlier as well, the medication will have to be prescribed by the doctor. So you will have to visit your pediatrician and seek his consultation if the child needs nebulization. And then if so, the doctor will prescribe the medication.
Okay, one more question from Jia Jie. The nasal aspirator is a really good investment. Oh, he has been using it for his son for 3 years plus. Wow. And then one more question from Tuan. Is the nasal aspirator suitable for everyone, even adults?
Yes. So basically there's no age limit for the nasal aspirator. So even actually we have some elderly customers. So basically they have problems blowing their noses, and so this aspirator can be used as well. So they can use the other two tips, the long reach or the power suction. So there's no limitation on the age. Yeah.
Okay, any more questions for Daniel? Any more? 3, 2, 1. Okay, I think there's no more questions for Daniel. I believe Daniel has a very good deal to share with everyone as well, right?
Yes. So we're having $10 off, $100. So this promo is on our website. So you need to key in the code 10 EYSOFF. So with this code, you get $10 off, and this offer ends at the end of this month. Okay.
Yep. So a very big thank you to Daniel for sharing your products as well.
You're welcome.
All right. And then as for UNSONG TCM Clinic, we also have an exclusive deal for you guys. So basically, we have a pediatric tweener trial session that's available at the UNSONG Premier TCM Center at Paragon. So this trial session is only at $50. That's exclusive of the consultation. So it's the treatment itself. Okay. So if you're interested, you can try it out. Bring your kid down to our Premier TCM Center at Paragon and let him or her try it out. And then if you would like to make an appointment, just call 6735-8006. Okay, once again, 6735-8006. And this is the end of our webinar. Thank you for everyone for joining us today. We hope you have learned a great deal about pediatric respiratory health. And then we wish you a very good weekend. Thank you so much. Goodbye and good night.